Hey everyone, I'm Greg Hill and I'm here to talk about Hipaa. Hipaa is the Health Insurance Portability and Accountability Act. Hipaa was passed by Congress on August 21st, 1996 during the presidency of Bill Clinton. It was designed to prevent several inconsistencies and resolve problems within the healthcare industry. During the early 90s, computers hadn't really been a thing, and they started taking over as they made business super easy. So Hipaa was designed to resolve a lot of the issues that they had in the early days, trying to do electronic file transfers and that kind of stuff. I mean, basically what was happening is there were like thousands of healthcare companies and insurance organizations around the United States. They would try to send patient records back and forth, and there was no easy way to do it. So Hipaa was designed to resolve a lot of the problems and inconsistencies they had while they were doing it, while preserving the liberties of the American people. Hipaa can be broken down into two parts. First section is the Portability Act, and what this is it's just like the name suggests. The portability section makes it easy for healthcare organizations and patients alike to be able to transfer their records back and forth and securely. So it allows people to move their healthcare plan as they transition through life. So for example, if you're changing a job and you want to take your healthcare plan with you, you can totally do that thanks to Hipaa. Um, Hipaa also makes it easy to modify your coverage plan as you need to. If you have a baby, you can go ahead and add them to your healthcare coverage, and this is covered under Hipaa. Hipaa also established the precedence of these certificate of creditable coverages. Basically, what that is a terms and conditions statement for your healthcare coverage plan. It'll explain the HIPAA rights of both the patient and the healthcare provider and provide more specific and detailed information about your coverage, such as, what exactly your coverage entails, when your coverage is lost, when you're eligible for Cobra and when that coverage is lost, and how long a COCC or the Certificate of Creditable Coverage is active for. Second part is the accountability section. This was designed to improve the efficiency and effectiveness of the healthcare system as a whole. So, like I said before, they were having issues transferring these files back and forth. And so this just dictates a lot of the administrative procedures for doing that. There's three different rules under this section. The first one is what most people equate with HIPAA. This is the privacy rule, and that specifies exactly who can access, and to what degree they can access your personally identifiable healthcare information. It sets out detailed procedures, and how you can transfer this information and who can view patient information. The second one is the security rule, and this has to do with it's more of a cybersecurity thing, as they're trying to send documents back and forth. Um, they obviously you want your information to be protected as they're doing this, and so the security rule, does just that. It was designed to ensure your confidentiality and that the integrity of the healthcare administration as a whole was being protected. One of the ways that they integrated both of these is they established unique personal identifiers for each healthcare organization and healthcare coverage plan. These are just little numerical codes that make it really easy. It's kind of like a zip code. To make it really easy for them to send information directly to the people that they want to send it to, and to make sure that the people that that you're trying to send it to are the actual ones that are receiving it. The last thing it established was the enforcement rule. And what that is it's just, basically a way for the government to see how effectively HIPAA is working and how well these procedures are being enacted. sets up kind of a police organization that goes around and they make sure that all these procedures are being followed. They're looking for compliance to preserve the integrity of the healthcare industry. And the enforcement rule also lists out punishments for people who violate this. So that's HIPAA.
I'm going to cover Cobra insurance coverage and how it relates to Hipaa. The term Cobra is short for Consolidated Omnibus Budget Reconciliation Act. Cobra is a program that has been put in place to provide temporary continuation of health insurance coverage when a group policy has been lost due to qualifying events. These events can include loss of employment, either quitting or getting fired, reduction of hours, so going full-time to part-time, therefore losing eligibility for benefits, divorce, so an ex-spouse who is not they were receiving benefits from prior to divorce can still enroll on Cobra to continue their health insurance coverage, or death. So if an employee passes away, their family still has the ability to maintain coverage through their deceased family member's group policy. I have a few facts about Cobra and I divided them into two categories: employers and participants. First thing with employers is that any private sector employer with 20 or more employees is required by law to offer Cobra options for participants who meet one of the qualifying events that were discussed earlier. Except for the federal government and churches or church-related organizations, they are exempt from having to offer Cobra coverage. However, the federal government does have a similar law to Cobra in effect that allows participants to extend their coverage. An employer must notify the plan administrator of termination in coverage within 30 days of a qualifying event, and both the employer and plan administrator have up to 44 days after that qualifying event to notify the participant of their eligibility for Cobra coverage. In regards to the participant, it is important to know that Cobra coverage can be expensive. When an employee is covered by their company's health plan, the employer typically pays a large portion of their premium. However, under Cobra, the participant is required to pay the full amount of the premium. There can be an additional 2% added to the total amount for administration fees, but this additional percentage is up to the employer and plan administrator's discretion. In order to participate in Cobra, a person must have been enrolled on the group health plan prior to the qualifying event. So if you're terminated from your employment, but you weren't on the group health policy prior to leaving the company, you don't qualify to sign up just because your job ended. You had to have been on the plan prior to leaving your job. An eligible participant has 60 days after the date their insurance coverage ended to decide to enroll. However, if you decide later on during that 60 days that you want to enroll on Cobra, you still have to catch up on the premiums for the prior dates that you were without coverage. For example, if your policy was terminated on April 1st, you would have until June 1st to decide to enroll on Cobra. If you decided to enroll on May 30th, your policy would become retroactively effective as of April 1st. So the participant must pay the monthly premiums for April, May, and then again in a couple days for June. Cobra plans are identical to the previous plan they were a part of. Plans change based on what an employer offers, so plans and premiums may change during a company's open enrollment period. Coverage typically lasts only 18 months on Cobra, but can last up to 36 for an employee's spouse and dependent if the employee became entitled to Medicare less than 18 months prior to the qualifying event. For example, if a covered employee becomes entitled to Medicare 8 months before the date of their employment ends, then Cobra coverage for their spouse and children would last 28 months, which is that 36 months minus the 8 months that they were eligible for Medicare. There are a few things to know about Cobra in relation to Hipaa. First, Cobra allows a person to avoid a significant break in their healthcare coverage. Since Cobra coverage is considered credible coverage, it can often be used to offset pre-existing condition exclusions. Finally, it allows you to remain covered during a break in employment, during a waiting period, or during a pre-existing condition exclusion period.